Good morning, good morning. On behalf of Patient Choice, I'm Dr. Dale Dangleben with your daily medical tidbit. What do I want to talk about this morning? I want to talk about metformin. A lot of folks are on metformin. A lot of people are diabetic and type 2 diabetes, where you can make an impact by diet and exercise. But a lot of people just take medications. They don't know what they're taking. They try to explain the pill. There's so many things wrong with that it's problematic, much less folks understanding the potential complications of these medications and the side effects. So metformin is a first-line medication for type 2 diabetes, right? And that's the topic, right? It has several benefits. Let's start there. It lowers your blood sugar, right? And it actually it reduces how your liver produces glucose, and it improves insulin sensitivity, which is important, right? And another thing is weight. It does not cause any weight gain or significant weight loss. There's a modest weight loss associated with it, which is good because weight loss and diet and exercise is important for type 2 diabetes, right? So it might help with weight loss. There's heart benefits, right? And there's studies about metformin that you can read up on. I encourage people to read. And if you don't know or you can't read, have somebody find the information and explain it to you, right? It does not lower your blood sugar to dangerous levels, all right? Unless you take in combination medication, right? So that's important to understand, right? And again, it's very affordable, so a lot of people, are on it because that's what they can afford, right? And there's a lot of research out there. You can do your own reading. They talk about reduced cancer risk and improving longevity. I don't know about that, but if it can control your blood sugar, obviously, that helps. So it's a good medication in that regard. But it does have side effects, and one of the biggest things that you see with metformin is the GI issues, right? You can get nauseated, the diarrhea, the bloating, and general abdominal discomfort. So pay attention to that, right? Another thing they talk about is it can cause vitamin B12 deficiency, right? So they say long-term use can decrease the amount of B12 absorption. So you get anemic, you get fatigue, and you get that what's called a neuropathy. So you get that numbness in your feet and your hands from diabetes, long-term diabetes, but long-term use of metformin can actually exacerbate that. So you can get some degree of neuropathy with metformin, and that has to do with vitamin B12. And so if you're starting to get that, you have to suspect that you're vitamin B12 deficient and maybe, up your B12 intake. Another thing I always talk about is lactic acidosis. If you're taking metformin and you go on long walks and you exercise a lot, and it can cause an acidosis, meaning that it builds up a lactic acid in your body, right? So that can affect your muscle. You can get cramps and all these things. It's important. And if you have bad kidney disease or liver disease, you have to be, cautious about the amount of metformin that you take, right? So the goal for type 2 is to get off these medications, but through diet, exercise, controlling your hemoglobin A1C, getting it, I would say, below 6.5, right? The textbooks might say 7, right? But if you can get it below 6.5, below 6.25, that's a good A1C for you for your type 2 diabetes, right? So again, the side effects for metformin is so mostly tolerable, all right? And check your A1C, check your daily blood sugars. It's important to do this. Get a diet and exercise regime. Just understand what you're doing and talk to your doctors. We need to get back to that. And doctors, I'm appealing to you to talk to your patients. Sit with them. Don't just write a prescription for metformin. Tell them what metformin does. Tell them how they can get off these medications. Tell them how they can better control the type 2 diabetes with weight loss and exercise. These are the important things that needs to do. Talk to them about lifestyle commitment, right? And strict adherence to diet, and explain to folks, especially in Dominica, what is dashing, what is banana, what is breadfruit, what is dumplings, how do these things affect your blood sugar? All these things we need to talk about. All right, so that's what I wanted to just talk a little bit about metformin. That's just an introduction to type 2 diabetes, because again, morbid obesity is on the rise, and that is associated with type 2 diabetes. And these are the kind of things that we need to discuss as a people to better improve our health. Okay? So do not abruptly stop your metformin and say, I'm going to take herbs, I'm going to do this. Talk to your doctor. And doctors, talk to your patient. All right? All right? Because stopping your medication does not mean you magically cured from type 2 diabetes. All right? Remember, this is not about type 1 diabetes. It's about type 2 and the management of it with metformin, which is an oral medication. I want you guys to have a great day. I'm Dr. Dangleben on behalf of Patient Choice. Peace.